I am your host, Nicole Will, and we're so happy you're here as we navigate the world with your aging loved one. We are here to come alongside older adults, family members, and the senior living community as we explore the world of aging and elder care with helpful resources, informative interviews, and approachable conversation. We get to do this together, so join us on our journey, and this is the Will Gather podcast. Earlier in her career, Dr. Heather McKay had just begun working in occupational therapy when her grandmother was diagnosed with vascular dementia. The family's challenge merged with Heather's work and personal life, inspiring her career and fueling a larger mission to improve life for people living with dementia and their caregivers. Through it all, Heather emerged as an international thought leader in dementia care and caregiver education, and one of the industry's most sought-after trainers and speakers. As a manager of Partnerships for Health, Heather provides training for professional and family caregivers and consults with organizations on topics related to dementia care. We get to have a down-to-earth, fun, informative conversation as Heather helps caregivers understand the impact that dementia has on our communication styles, why communication breakdowns happen, and how we can improve our interactions with our loved ones living with the disease and make life better for everyone involved. Here is my interview with Dr. Heather McKay. Today, I have with me Dr. Heather McKay. You really merged your personal experience and your work life. I am so curious to hear, how did that happen? What brought you and led you to dementia care? And welcome. I'm so happy that we get to talk face to face today.
Nicole, it's a treat to be with you. Thanks for having me on the podcast this morning. I think I'm lucky, like many people, to have had that coming together of my work life and personal life. I'll take you back to the beginning. I'm an occupational therapist by training. I've worked for over 20 years now with older adults and their caregivers in a variety of settings. My professional OT journey started in the hospital, where I was working with in a neurology team with folks often dealing with dementia, but many other diagnoses. My professional path soon branched out to community-based practices, where I met folks dealing with dementia in home health and hospice. And somewhere along that journey, Nicole, my grandmother was diagnosed with vascular dementia, the second most common type. And I believe at that time, my career got a boost of motivation and inspiration as my family was navigating this dementia care journey together in the mountains of Western North Carolina. And that's where my Appalachian mountain accent comes from.
I love it.
Soon after I had met a team in home health and hospice and really established a great practice there, at the same time, I established a consulting company called Partnerships for Health. And that let me get out of the office a little bit and meet families all over the country, but also organizations and teams of dementia caregivers. So in all of those roles, I was putting my head together with families and organizations and my own family around the challenges of dementia caregiving. And what I noticed was that, these challenges all involved doing the things that we want and need to do together at every stage of this disease. As an OT, we call those health supporting activities that give life meaning occupations. And so in all of those areas, I've been thinking about, with all my partners, how to help people living with dementia and their myriad of caregivers to do the things that they want and need to do, despite a progressive disease.
Yes, I love how you talk about bridging the gap between that knowledge and practice. You not only saw it in your profession, but then you were actually walking through that with your family, and it became really real and personal. And I think that's such a great perspective to have, because a lot of times we can have that head knowledge of what goes on when we're walking through that disease process, but actually seeing it and experiencing it with a loved one can really shape, okay, here's how I want to offer my support and offer my care to those around me that are going through it. And based on all of the great work that you've done, you've been working with family members, you've been in different settings, professional settings. How is this kind of caregiving with dementia loved ones different from other types of caregiving? How does that play out?
Well, it's true, Nicole. Even if I start to tell stories about families or clients that I've met in my practice, it's inevitable that sometimes I'll take that therapist hat off and think and talk to you like a granddaughter, because I really believe I learned as much through that experience when my grandmother gave me the front row seat to over a decade of dementia caregiving with my own family. And I honestly believe that many of the lessons I learned in that personal experience have fueled my practice more than any class or degree program that I've been lucky enough to finish. And I honestly think that my grandmother is still teaching me. One of the things that stood out, both in my practice and in my personal experience of dementia caregiving, is that this type of caregiving is different than other sorts of caregiving. You know, not to rank them in importance, but dementia caregiving is different from caring for a loved one with cancer. It's different from caring for a child with a disability or some sort of a challenge of another diagnosis. And I think a family member put it to me the best, because I was often thinking about what makes this caregiving so challenging. I knew from the research that dementia caregiving had real impacts, not just on the person living with the disease, but on the caregiver himself. In fact, the stress that comes along with dementia caregiving is notorious for impacting the health of the caregiver. It's a scary statistic, but caregivers dealing with dementia, helping a person living with dementia, are often experiencing negative health impacts greater than and faster than the person with the disease. So I was thinking, what makes it so different? What makes this special, a different kind of caregiving? And one family member said, I've cared for loved ones with other conditions. She's experienced as a caregiver. She said, in fact, my mother had cancer and I was her primary caregiver all the way to the end of her life. She said, but what's different about my dad with dementia is that our communication has been broken from the beginning of this disease. It's been difficult to communicate with my dad. She remembered times when she was caring for her mother with cancer, when the two women would curl up next to each other in the bed and talk about the challenges they were both facing and feeling and the road ahead. And they felt connected on the same page for the entire journey. She said, Heather, with my dad, not only are we not on the same page, sometimes he's asking me to go home when we are at home.
Yeah.
We're not even in the same house,
Right.
She said. And so it's been a topic that I've really delved deeply in with my research and in my practice with families, and paid close attention to in my own family experience of how this communication breakdown, starting early in the disease, influenced the entire journey of caregiving. Communication is one of the most common challenges facing folks dealing with dementia and their caregivers, and one of the biggest topics or most popular topics in my family consultation visits.
I could see that, how different it is. And it really is that fundamental piece of communication. And that affects everything.
Broken communication affects every part of our lives. And in dementia, it's extra challenging because it's always changing.
Yeah.
Just by the nature of this progressive disease. One caregiver said it so brilliantly. She said, what worked for you yesterday, Heather, is not guaranteed to work for you today. And so caregivers are constantly facing communication challenges and digging into sort of a toolbox of communication strategies to adapt their communication in every stage of this disease.
Yes, it's that adaptation. It's constant, the ever changing, it never ends. So, with that said, what are some of the things that every dementia caregiver should know to feel supported to make life better for themselves?
I've learned from so many caregivers of all stripes, frontline caregivers. We're talking family caregivers who don't have the kind of healthcare experience that I've had, but also non-medical partners on our team. I've learned from housekeepers in assisted living facilities and other folks. The maintenance man at times has a terrific toolbox of communication strategies. So I've been pulling from all of those everyday experts to put together some knowledge and skills that I think every caregiver could use. Well, before I sort of get into the nitty-gritty of that communication toolbox, I think some terminology is helpful for every caregiver. It helps to sort of just get us all on the same page of what we're talking about today. And it's one of the questions that still comes up every week in my conversations with caregivers. People say, Heather, what is the difference between dementia and Alzheimer's? Help me with the terminology before we get into skills training.
Yeah.
And one of the best explanations has come from just experience, saying this so many times. It's not common knowledge. We could all share this with somebody that we know, and I bet it would be new information. But I like to say it like this: dementia is the umbrella term. It's a category of diseases. My hands just sort of automatically go up when I think of an umbrella across the top, because there's so many different types of dementia under the umbrella. But one thing that really helps me and gets heads nodding when I'm talking to caregivers just across the kitchen table is when I say dementia is a word like cancer. That clicks. See, most people know that cancer is a category of diseases. And they know that there are lots of different types of cancer: skin cancer, lung cancer, breast cancer, colon cancer, the list goes on. Most people also know that skin cancer is different from lung cancer, but they're both cancer. The terminology for dementia works the same way, where dementia is the word up top, and under this umbrella, we've got Alzheimer's disease, vascular dementia, Lewy body dementia, frontal temporal lobe dementia, the list goes on. And similarly, Alzheimer's disease is different from vascular dementia and all the others, but they're all dementia. So when we think about communication strategies, it's helpful to have some tips and tricks that work for every type of dementia. In other words, there are some similarities across all of these diagnoses that impact communication. And some general tips or strategies can work no matter the diagnosis, no matter what type your loved one is experiencing. Another sort of, I think, must-have knowledge about dementia, good for every caregiver, is that if we looked at two brains side by side, there are some changes that would be obvious between a healthy older brain and a brain changing with dementia. Probably the most obvious would be that the brain with dementia gets so much smaller if we were looking at two side by side. One of the most impactful changes that happens to this brain with dementia is in the color. If we looked at a brain with dementia, it's darker than a healthy brain aging normally. And that color difference, I think every caregiver needs to know about, because it affects communication. Now, let me give you just a short explanation. This is Neuroscience 101. Brain cells are sick before they're dead. It's not the rocket science, but it's important for everybody to know that 1 billion sick cells are still hanging on throughout the progression of this disease. They're not gone yet. We can't count them out. But what you need to know about a sick or unreliable brain cell is that it'll fire for you 1 minute and quit you the next. 1 billion darker cells can fire in unison. And one caregiver said about his wife, sometimes her communication is sharp as a tack. He said, sometimes we're communicating and it feels like we're on the same page. He said, but sometimes I can't get through to her. And when I showed him the picture of a darker brain and explained that the 1 billion sick cells will fluctuate, they're on again, off again, he said, You're explaining exactly what I've noticed in my wife's communication is that she's on again, off again. And fluctuations are common through every stage of the disease. As long as there are sick, unreliable cells, then caregivers will notice good days and bad days. They'll notice good times of the day when communication seems to be firing on all cylinders, and times when everything seems harder to communicate. Lots of caregivers have heard of this term called sundowning. Sundowning is when actually, as a person with dementia gets tired, a lot of their communication starts to break down. And one caregiver said, I've never heard a good explanation of that. It really has nothing to do with the sun. I said, yeah, exactly. The change happens when 1 billion sick cells get tired and close shop. She's an expert noticer. She said, I think I noticed my husband's communication is the toughest in the morning. She said, I've heard of sundowners. My husband's got sun-uppers. And looking at that picture of a darker brain, she could see that sometimes in the morning, before he'd had breakfast, before he'd kind of gotten, all engines firing, that was the hardest time for them. So I actually help caregivers to maybe notice, when is your loved one's communication the best? And when do you notice that some of those sick, unreliable cells might not be firing for your loved one, so that we can flex and use some strategies at the times when we need them the most and they work the best.
Mm-hmm. It's that encouraging others to look at and pay attention and notice. That's part of it. I think that is so helpful in just understanding the root cause.
Oh, doesn't it? When families and professionals of all stripes can notice these fluctuations in their loved one or client's communication, then they can adapt and actually be a little bit more, I'll say, comfortable with their communication strategies at the right time in the right way. These folks I call expert noticers.
I love that term. And I think that is the best example I've heard it explained to me. So thank you for that, of those sick cells that are firing appropriately at the right times and then not at others. And that does explain those good times and those not so good times. And it helps you visualize and have compassion for what's happening.
When I asked a caregiver, had you noticed some fluctuations in your loved one's communication? Oftentimes they might explain that, oh yes, in the afternoon, everything gets harder as my dad is tired. We actually have adapted our whole routine to start, our bedtime a little bit earlier. She said, we would even make all of our appointments in the first half of the day, when his communication and doing things together is easier. She said, by the time 4 o'clock rolls around, we're starting to close shop around here. And another caregiver even said, if we don't get our appointments done in the first half of the day, you can forget about it. Another caregiver who noticed the mornings were particularly tough, she actually had some great strategies for starting the day with her husband. She noticed that if she brought a little bit of orange juice to the edge of the bed, gave him some time to have some juice and then just a little chit chat there at the bedside before she asked him to do something, not only was he having a little more time to wake up, she was using some of that good chit chat that actually works better for people with dementia, and that chemistry of the blood sugar coming up with that little bit of orange juice. She said it made their whole morning routine easier. She said, the first time I asked him, are you ready to get up? And he said, yes, I about fell out of that chair. She reminds me that when it comes to communication with people who have dementia, it's not just about what we do, but about how we do it.
And I found, and you talked about that, how some of the best interventions that we come up with are from people that are, like you said, not necessarily those health professionals, but a spouse, a housekeeper, a care provider, someone that is in the day-to-day and is creative and thinking outside the box and letting go maybe what we have heard is the I'm using quotes, right way to manage a situation, but really paying attention to those details and interacting with the individual to have it be successful.
When we think about caregivers trying new things and noticing what's working and what's not, oftentimes I find it helpful to pin a little bit more information about the brain with dementia to help them really pay attention to what's happening when they try new communication strategies. For instance, Nicole, many people have probably heard about short and long-term memory. In the brain, in the memory center, it's called the hippocampus, we've got memory files that hold different types of memory. I think it's pretty common knowledge that all types of dementia will take short-term memory early on, but leave long ago memory. Well, that's a good foundation, but that's not the whole story in the memory center. A lot of caregivers have noticed that their loved ones can ask the same question back to back to back to back. They're noticing a memory file, a loss in a memory center, in a memory file called immediate recall. And not everybody's heard of this type of memory, but it affects our communication every day. Immediate recall, when it's lost, a person has trouble understanding, boom, what just happened? Boom, it's that fast. Caregivers will tell me, Heather, it's 100 questions, the same question 100 times before breakfast. And I know the struggle is real. Answering repeated questions is just a part of dementia caregiving. One wife is caring for her husband, and she says, Heather, he wakes up in the morning like a little mouse on a wheel with one question just rolling over and over in his mind. She said, he asked me first thing in the morning, when will my daughter be here? And she says, it starts and it's 11 times. She said, I answer him the same way every time because, bless her heart, her daughter is very reliable and comes at the same time every day. But her husband can't hold on to that information. She says, honey, she'll be here at 3. He will turn around and say, what time will she be here? Honey, she always comes at 3. I expect her at the same time. He'd say, I'd be getting ready if I knew when to expect her. She says, we don't have to get ready until later because she always comes at 3. Now, she's noticing that immediate recall is changing for her husband, but she'd never heard of that type of memory. She was thankful to have a name for this, but she asked me one other question. She said, Heather, explain to me this. How can he understand or hear some things, but not the other? She said, let me give you an example. When I get frustrated, and I said, believe me, this is terribly frustrating. It's normal that you get frustrated. She said, well, when my sweet little 3 o'clock turns into 3 o'clock now, honey, she said, he will wheel around on me. She said, I'm in trouble. He'll say, I don't need that kind of attitude out of you. She said, but why am I in trouble for something that I've answered again and again? And I point to another memory file called emotional memory. This one, folks, has nothing to do with the facts. It's all about a feeling. And while dementia takes some memory files, it spares others. Emotional memory sticks. And you might have noticed that there was a difference between 3 o'clock and 3 o'clock. It's in the tone. And oftentimes people living with dementia will pick up on our tone when they don't actually remember all the facts. I get folks to kind of tune in to their own emotional center of their hippocampus. To me, Nicole, it's always felt like a little radar. I have a radar that scans for the feeling in every interaction, like do 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 do. I pick up on a vibe. We all do this. If I'm scanning for the feeling in someone's communication, I'm picking up on things like, are they in a hurry? Are they nervous or relaxed? Does this person make a good first impression? A good first impression lands on the emotional memory file. And most folks that are listening are thinking, yep, it's not about what they say. It's about how they say it. You're tuned in to that emotional memory when you pick up on things like, somebody's not shooting you straight. We have these ways of talking about this in our culture. We don't exactly say the emotional center of the hippocampus, but when you pick up on somebody's not shooting you straight, you're scanning for a feeling. You can pick up on things like tension. When we say you could cut the air in there with a knife, that's my emotional memory file scanning for the feeling. So I mention that to just about every caregiver I meet because it's not common knowledge and it's impacting every interaction that we have with someone who has dementia, starting very early on and all the way through to the end of this disease. It's one of the most important things I've learned about communicating and dementia is that I've got the radar and so do they. That people with dementia will pick up on a feeling and we'll get busted on our tone. We'll get busted on communication that feels like a rush, if it feels pushy, or very importantly, can you tell when somebody's talking to you like they think you're stupid? Everybody catches that, and so do people with dementia. So when I learned about the emotional center of the hippocampus, I did a 180. I shifted my communication off of the facts, pay special attention to the feeling.
We do that all the time. Like you were talking about that radar. And can you imagine picking up on all of those emotions and then not knowing what to associate it to with those facts? I mean, so confusing.
Yes, you're putting your finger on another change that happens in this memory center that leads to these predictable communication breakdowns. It's another memory file, Nicole, called situational memory. You put your finger on it when you said people with dementia don't always know what's happening. Situational memory is actually how our brains understand how things got this way. We understand our situation because in that part of our memory center, we hold information together in order. Let me take our example of you and I today here on this call together. We've got a situation. We both know why we're sitting in these seats. It started with A. I remember meeting and learning all about the Will Gather podcast, and A led to B when we met, and B led to C when we scheduled a call, and C led to D when I woke up this morning and said, oh, I'm excited to talk to Nicole. A led to B, led to C, led to D, and that's how we got here. Imagine not having that situation held together in order to understand how things got this way, what we're supposed to be doing right now. Expert noticers will hear in their loved one's communication what I call situational memory questions. When they say, how did I get here? What is the name of this place? Where are we exactly? They'll say, what am I supposed to be doing right now? Caregivers listening to this are nodding their heads at home. They're hearing these situational memory questions, and they're noticing that when they explain the facts in order, sometimes it doesn't make sense to their loved one. In fact, one caregiver said, I've explained to my dad till I'm blue in the face how we got here. He looks at me like I've got 3 heads. He says, that never happened. You're talking about somebody else because you never explained that to me. Yeah. Or you made those decisions without me because we never talked about that. Caregivers are literally saying, Heather, we've talked about it 1,000 times. But Dad has trouble holding the facts together in order to understand our situation. And as just a normal person, when I get frustrated, boom, he responds to the feeling in my tone. So these communication breakdowns are as common and predictable as the sun coming up. Yeah. It's part of dementia caregiving.
You're providing real clarity because you're able to walk us through the different challenges and the breakdown with the brain. Is there anything else you want to tell us about those brain changes that you might not have shared yet?
Let me shift out of the memory center for a minute then. We're starting to put together, as you said, some information about this brain that's changing with dementia in specific ways, specifically that impact our communication and lead right into these communication challenges that we all know like the back of our hand. But most folks think first about memory and dementia. We don't always think about the language part of our brains. And I like to say to every caregiver that I meet, dementia is a language disorder as much as it is a memory disorder. In the part of my brain that's right behind my ear, running along the side of my head, I've got the part of the brain that understands language. That's changing too. People with dementia are having trouble understanding some types of language more than others. Just like in the memory center, where we have memories stored separately in different types, language has its own file system too. One of the files that changes early on for people with dementia is the file labeled formal language. Now, this is terribly inconvenient, folks. Formal language are the information words. It's the explanations, the directions, the instructions, all the good meat and potatoes behind what we want to express when our loved ones are asking us what we're supposed to be doing, why we got here, how things got this way. It's a double whammy when they don't understand our formal language and explanations as well as they used to. But that just turns on some creative problem solving for lots of caregivers I know. They said, Heather, I've figured out that words are not my best tool. Words actually get confused when Dad doesn't understand all of my explanation. I've started using more visual cues. I said, bingo. This is an expert noticer who realizes there's more than one way to get our point across. She's using her body and gestures. She's picking up things in the environment to show her dad. She's using the props and objects around them to help them talk about things that they can both see. He catches the visual cues oftentimes better than her words. Now, she asked me to clarify in understanding language one thing. She said, Heather, when I walk in the house and say, hey, Daddy, how you doing? He understands that clear as a bell. And he says, hey, honey, I'm good. How are you? And she says, we can carry on this social back and forth chit chat just without skipping a beat. Now, in North Carolina, we call this swapping howdies. Swapping howdies is that automatic back and forth chit chat that rolls with a rhythm that's sort of a tick-tock. I say something, you say something. Kick it back to me. I ask you a question, automatic answer, automatic next question. That language is stored separately from formal language. Chit chat lasts longer than the facts and the meat and potatoes, the instructions and the directions. So good noticers, expert noticers and experienced dementia caregivers have chit chat in their toolbox. They realize that if they can start their interaction with a little bit of swapping howdies, that social communication that puts us at ease and helps us feel at home, see, there's an emotional component to that, then they've realized that it's a really nice lead-in to then asking their loved one to do something. If they sit down, have a little chit chat before getting started, oftentimes they can drive around that automatic no. When it's time to switch to a question with formal language, they pair it with a visual cue and they have a better shot of getting their point across. So we're starting to put together some strategies based not just on what's happening in the memory center, but what's happening in the language center as well. Let me say one other thing about language. It's not just understanding the words that they're having trouble with. They're having trouble producing their language too. So we understand language in one area of the brain and we spit it out in another. Spitting it out is harder for people with dementia, and it's in formal language that change happens first. So not only do they have trouble understanding the explanations and instructions, they have trouble telling us what they want us to know, instructions they want to give us. I remember thinking about my grandmother's, I can picture her face when she wanted to tell me something and she couldn't find the words. I saw the frustration on her face. I could hear it in the tone of her voice. She knew that if she could just tell me what to do, I would do it. I've been following instructions from my grandmother since way back. She'd get no resistance from me, but she couldn't spit it out. And I wished at those times I was a better mind reader. Caregivers that watched our communication breakdowns gave me great advice. They said, Heather, if you can ask her to show you, if you can watch her visual cues, if you can ask her to show you or take you to the thing she wants to tell you about, oftentimes you can use more visual cues in your visits and in your activities together that make the communication a lot less frustrating for her too.
Yeah. When you were talking, I just had this visualization of that teamwork. You're a team. She is sharing with you, and you need to work together to be able to then understand each other. Really, it is that reciprocal. And I never really thought about it that way before. So it's putting all of those common sense strategies together is so helpful for people. I can't even imagine how many caregivers and lives that this is going to affect, just to feel like they can understand those brain changes. They can have that communication. What else can you tell us about that? I'm learning so much as you're talking.
Well, you said the word that I think just excites me the most. It's that teamwork, that being together and almost combining her skills and abilities, the resources that she has left at every stage of this disease, but all of her skills and abilities come together with mine. The clients that we support come together with the skills and abilities of the caregivers on their team in creating that teamwork, that doing together spirit. One of the most important communication strategies that all stripes of caregivers can have in their toolbox to really make that connection with the person who has dementia and solidify that teamwork from the very start of your interaction is to get the interaction started on the right foot. Now, what do I mean by that? I mean that the first few seconds of our interaction could make or break the rest of our communication. We've talked a little bit about the brain changes that happen in the memory center and the language center. There's one other part of the brain I want to point to, and it's right behind our forehead. We call it the frontal lobe. And the frontal lobe is responsible for all this good emotional control, impulse control, all of those sort of decisions that we make about how and when to respond and how to make sort of the responses and communication that are right for us. That's judgment, right behind your eyeballs. That part's changing too now for folks with dementia. And what it means is they have a little less impulse control, judgment, emotional control than they used to. What's spared in this disease is a protective reflex called fight, flight, fright. It's this little button that I think of as a startle button. People who are changing in all these areas of their brain, not understanding the situation, not comprehending all the words they hear, not able to communicate the way they want to, and without that impulse control, are quick to startle. And that startle button at the beginning of our interaction can just make everything that happens next harder. So I think about how can I get my interaction started on the right foot, driving around that startle button to help our interaction actually begin in a way that's more comfortable, emotionally kind of rubbing the person right, and not scaring the pants off of them in the first few seconds. So this is a really useful technique for lots of folks, not just with dementia, but especially in dementia care. We need to make sure we're coming from the front and letting people see us before we're in their personal space. Giving folks a high visual cue, just waving to get their attention, is a nice way to let them know, hey, I'm just here to say hi. If I stick my hand out in that old familiar gesture of touching hand to hand, as we do in our culture, it just lets them know I'm coming closer to greet you, not to do anything else weird or scary. If we connect hand to hand first, it gives me a chance to slide in a greeting that's a social, automatic kind of chit-chat communication that a person with dementia has a better chance of understanding. Some of the last steps of my approach, Nicole, are to get on the person's level, which means moving out from in front of them to the side and down if they're seated. I say, pull up a chair or kneel if you're comfortable. Make the furniture work for you. Make sure there's a chair beside your loved one's favorite seat so that you can come in and get low. Making that connection on their level and having that little easy greeting before you ask the person to do something can be the start of your interaction that sets you up for success.
Yeah. It does. When you were talking about that chit chat and that emotional, right? We read those emotions. It's that first impression that if someone comes and there's not that warm greeting, I, as a person that doesn't have dementia, am already like, wall up, shut down. And so you can imagine what that interaction just to set you up for success in the right way, right away. And then you can progress towards some of those tasks or doing some of those things that you need to get done in a day.
Absolutely. Getting our interaction started with some of these general principles that approaching the person is the first step to positive communication, driving around that fight, flight, fright reflex, giving them more visual cues, things that they can see and understand better, and using some of that good automatic back and forth chit chat that keeps the emotional tone friendly and respectful. We're set up for some success. Now, we've got some of the basic principles as foundation for good communication. Let me add some specifics to some of these caregivers out there who are looking for communication strategies, maybe in particular categories. I think of my communication toolbox as organized. I've got tips and tricks for doing things. I've got communication strategies for having social visits, a little bit different. And I've got a third category of communication strategies for dealing with distress. What do I mean by that? When your loved one's upset and they don't understand the explanations, and what you want to do is help them feel better to reset and carry on with the day. When an explanation of the facts just doesn't satisfy, we need some other communication strategies to help ease our loved one's distress and bring that upset down. Let me give you a little insider trading tip. That third one, it's the hardest. It's the toughest kind of communication, but I guarantee somebody logged on to the podcast this morning to find out just about that. My loved one is upset. He is fit to be tied. He is chewing nails and spitting tacks. How am I supposed to ease his upset so we can get through the day? The insider trading tip, folks, is get good at the first two. It means I'm going to give you some strategies for dealing with distress this morning, but I want to start with a few tips in the first two categories, because the better you are at doing things together and the better you are at staying socially, emotionally connected in those visits that just have nothing to do with the facts, that can actually ease distress proactively. In other words, you'll have less distress if you can really hone some of these strategies in doing things and having social visits. So let me give you a couple tips for those first two categories, and then we'll get to the nitty-gritty that everybody came for. Helping people do things. We've already said that it's really helpful to show folks more visual cues of what you want them to do, but it's also helpful now to break down your instructions and give less information at the time. After we've gone through a nice explanation of the changes in this brain, it makes good common sense then that I don't want to give my loved one all the information up front before we even get started doing something. It could set me up for that automatic no. So expert noticers are breaking down instructions into step-by-step how-to instructions and using fewer words. They're also asking their loved one to help. Would you help me? do this, it has a little bit different emotional vibe than saying, you need to do this. See, it just changed the feeling. If you help me, it's a whole different vibe. If I ask a person to try, if it seems hard, give it a try. I'm changing the feeling behind the instruction by taking a little of the pressure off. Here's one of my favorites. I'll say, why don't we do it together? When the word together rolls off the tip of my tongue because it has a different feeling than asking the person to do something because I said so. When we do it together, I'm not the boss anymore. When we do it together, I can actually demonstrate and show how to do it and let them follow me. And when we do it together, it's much more of that teamwork that you've already put your finger on that just feels better to a person with dementia. So these are some really good tips. Let me give you one other one to plug into your toolbox when it comes to doing stuff. It's the idea that we need to be able to take no for an answer. And one of the common mistakes that I run into, caregivers of all stripes, it's easy to make this mistake. When you hear that first automatic no, we're asking for trouble if we just plow through and do it anyway. Instead, what I want you to do is think about, okay, they said no at first. I'll take that little communication strategy, throw it back in my toolbox. It'll be good for later. Reach in and pull out another one. If you get another no, that's okay. Back off, give it a few minutes, and reach in for another strategy when you pitch it in differently the third time. It's this ability to go in and out of your toolbox for more than one attempt. And you'll hit on pay dirt eventually. You'll find one of those strategies that works. Don't throw any of the old ones away. They're going to actually be there in your toolbox for the next time you approach this challenge. I think about it like going in for a wrench. I might pull out the first wrench and it's not quite the right fit. Don't throw that wrench away. Put it back in your toolbox and reach for another one. You're getting closer, but not quite the right fit. Reach in for the next one and boom. I bet you'll find success with one of these if you keep some of these strategies in mind. What about having social visits? Sometimes we got to just get together and shoot the breeze, spend some time in a way that feels good to my loved one and feels good to me. We don't have an agenda. There's nothing that we necessarily need to do. So let's keep a few strategies in our toolbox for this kind of communication. One of my favorite sort of rule of thumb here is go with the flow. It's not rocket science, but it's a reminder to us all that if the facts aren't quite right in my loved one's story, I can let that go just for the sake of our connection and our communication in this style of communication, which is just visiting. Sometimes people with dementia will mix up their stories. They'll get part of this story put together with another story. They might even put that together with something they heard on the TV this morning. Without situational memory, a lot of these stories kind of start to blend together. I think of it too sometimes as rewriting history. They'll tell their old familiar stories, but they'll tell them with a spin that family members know not to be exactly accurate. This is a challenge for families who know their stories like the back of their hand. Don't trip on correcting those mistakes, because it could just be that break in the emotional connection that sends your visit kind of falling flat. Going with the flow, even when the facts aren't exactly accurate. I ask folks questions about their stories, and I fill in the blanks if I know some of the things about them. I'll use some of their words to help them tell the story that I've heard them tell before. All of that can help your social visits come together with a lot better communication. One more strategy that caregivers really shared with me when having a social visit with my grandmother was kind of difficult. And I say that, Nicole, I'm sort of going back to those days in my mind now. It was surprising to me that visiting with my grandmother was so hard. In fact, I had been sort of a grandmother's girl. I had spent many hours with my grandmother just hanging out. She lived within walking distance of my house, and I could walk to my grandmother's place and hang out with her anytime I wanted. What I realized when she moved into a dementia care unit and my visits were falling flat, a big realization was that we weren't visiting the way we used to. She was thinking about other things. In fact, all of the questions that she would ask me about my life and what I was up to and my school and my friends, those weren't the questions that she had on her mind. She would literally see me coming through the door and say, "I'm a Mahaffey. What are you?" Oh. I thought to myself, well, this is off to a bad start, because I'm a McKay and you're a McKay and we are the McKays. But she was actually thinking of herself in an earlier time in her life. Her visits and her conversations were about her brothers and sisters, her mom and daddy, especially her dad. She was thinking of herself as a Mahaffey. That was her maiden name. And she would say, "My daddy's Frank Mahaffey." And I would just sort of draw a blank. I had never met Frank Mahaffey. Of course, I'd heard about him, but he was dead long before I came along. And I didn't know how to carry on conversations like this about people that I didn't know, things that didn't connect with me. And honestly, sometimes I would leave those visits in tears. Yeah. I knew that we had not made a connection, and I saw her frustration and my heartbreak in no time. One of the caregivers in her facility asked me, "Heather," by the way, I was already an occupational therapist by the time this was crashing and burning. She said, "Heather, don't you teach this stuff?" I said, "I do, but it's harder when it's personal. Yeah. Something's not working for me in these visits." And that teammate said to me, "What do you tell other families to try?" And it dawned on me, I wasn't walking the walk. I was talking the talk in my professional life, but it was a whole lot harder to walk the walk in this unit with my grandmother. Yeah. I thought to myself on the way home that day, I better not come empty-handed. We need some visual cues. We need some automatic greeting that works better and connects with her. And then we need some things to do together. Yeah. So I stopped by the house and picked up an old picture of her daddy, Frank Mahaffey. And I walked into the unit the next time and said, "Any Mahaffeys in here?" She said, "I'm a Mahaffey. What are you?" I said, "I'm a McKay, but I know your people." She said, "You do?" Wow. I pulled out the picture and I said, "You're Frank Mahaffey's girl." And she said, "I am. That's my daddy right there." And we started a conversation about an old story that she had told me 1,000 times, that they lived on Frank Mahaffey Road, that her daddy stayed in that little white farmhouse on the end of that road, and everybody knew where to find him. I said, "Yeah, because they can come and ask him questions." She always loved to say that. "Oh, yes, they will ask my daddy questions." But the next thing off the tip of her tongue was, "He's not a politician." And she loved when I said, right after that, in that social chit chat, I said, "That's right, he's got common sense." She loved that TikTok of that social greeting. And when we brought an activity into the visit after that good connection was there and made, she would do anything with me. In fact, sometimes I would just bring an activity, like I'd stop at the grocery store and pick up some beans to snap or some corn to shuck. And we would go out into the little courtyard with a couple of other residents that lived with her. And we would shuck that corn or snap those beans and talk about old ways of prepping food or farming or doing things that all of those residents had in common around some of the most basic communication strategies in my toolbox. It really turned our visits around and made doing things and socializing feel a lot more satisfying to me and to her. Well, we come all the way through those strategies to leave you with some of the real goods here. What can I do when my loved one's upset? How can I help ease their upset when understanding the situation is just out of their grasp? Well, let me point back to our positive physical approach. Getting that interaction started on the right foot is one of the most important steps when a person's already upset. But then I want to help folks use some redirection and distraction to put their loved one's mind on something else. But here's an insider trading tip, Nicole. There's a little timing to this. Everybody on the line today is thinking, yeah, easier said than done. Changing my husband's mind when he's got this little mouse on a wheel and he's upset about it, it is like act of Congress. So I want to give you a setup, an insider trading tip about how to lead in to the redirection and distraction. And I'm going to walk you to it through connecting to their feeling. Why is this a setup? It's because if I'm upset about something, in this way, Nicole, we're actually a little more similar than we are different. If I'm upset about something and I called you as my friend on the telephone and said, Nicole, I have had the worst day. It's just been awful. And I download everything I'm upset about. If you on the other end of the phone wanted to ease my worry by changing the subject, but you did it a little too quickly and said, Heather, listen, I hate that it's going so badly, but we're still going to go out tonight, aren't we? You've had such a bad day. Listen, we'll go anywhere you want. If you go to the redirection, distract me from what I'm upset about ever so slightly too quickly, it hits that emotional center of my hippocampus and it rubs me wrong. It's just a matter of timing. But in our culture, we have a way of talking about that feeling. We say, we're sweeping the problem under the rug. Bingo. We're sweeping the problem under the rug when it moves a little too fast. So the setup is take a deep breath, back up, and get connected to the feeling. Ask the person what they're upset about. Listen to what they say and repeat back some of what you hear. You're upset about your mom, or you're fit to be tied and frustrated that it's not going well. I'm not solving the problem. I'm just repeating back what I heard. It lets the person know that I'm listening and I'm understanding how they feel about this. Slide this into your communication toolbox. The next time you hear someone upset, use some empathetic statements like it looks like, it sounds like, or it seems like, and then fill in the blank. When we open with some of those empathetic statements, it helps connect to the feeling. And once a person feels heard and understood, then and only then are they more likely to go with you to the distraction. And they need the distraction, Nicole. They need us to take them to the next thing and put their mind on something else. It's relief. It's better than medicine. But getting them to go with us means we first have to connect to the feeling. And it means talking a little bit more about what's on their mind and how they feel about it.
Yeah. And that whole idea of validating how they're feeling, right? It's entering in that with them and saying, I know this is so tough. And then they feel heard. And then you're more likely to then have that emotional connection. They feel it's safe. Then we can move to the next step, which I know you'll talk about, which is that distraction. I feel like too, let me know your thoughts on this, but it really is a lot of inner work on the caregiver, because you think about, you are in a sense letting your ego go. You gotta let it go. And you're saying, okay.
I just took a deep breath. I took a deep breath when you said that. Yeah. One of the things that this calls on us to do as dementia caregivers is to take a deep breath and sort of be in control of us.
Yeah.
And the more we can be in control of our own communication and our own tone and vibe, and feeling, the more we can control ourselves and our own behavior in this tough communication, the better outcomes we're going to have.
Yeah.
You've put your finger on it. It really does have us look to ourselves in changing communication for better outcomes for us both.
Yes. Yes, absolutely.
One of the things that I'm thinking of are all of the tough things those caregivers out there are trying to do with their loved ones or their clients living with dementia, and at all stages of dementia. Family members are trying to get their loved ones into the bath, when they say, no, I don't need a bath, or I've already taken a bath, or, I don't need your help with the bath, I'll do that later. There are a million ways that folks living with dementia who are confused about the situation can just tell us no 11 ways. Calming yourself, bringing yourself down so that you don't slip and get busted on that tone that starts to come across as pushy or come across as bossy, means that I can go back into my toolbox for an empathetic statement. Like, I know you don't feel like taking a bath right now. I haven't solved the problem, but I've pointed out how they feel. I get it. I understand. It seems like you've already done this, or like we do it every time you turn around. Connecting to that feeling sets up an interaction where they're a little more likely to hear and get connected with you when you pitch in a redirection. Like, why don't we do it the easy way today? It's so funny that rolls off the tip of my tongue, as if I would ever do it the hard way.
Exactly.
It's a little communication strategy to say, this is a pain in the neck. It feels like I'm having to take a bath every single day. But if we do it the easy way or get started on it together, then maybe it'll be finished sooner.
Yeah.
Lots of times I talk folks into doing things with me in a way just so that we get it out of the way and it's done with.
Mm-hmm. Mm-hmm.
All of those are just slight redirections in how I pitch in my communication in a way that feels better and validates their feeling from the very beginning.
Yeah.
Some of the best stories come from caregivers who take these basic strategies, Nicole, and adapt them, tweak them just right for the situation that they're facing in real life. I'm thinking of some of the biggest, most difficult challenges that families face. One particular one comes to mind. One caregiver said to me, Heather, we're at a crossroads right now with mom. She's on the brink of needing to make some really important financial and legal decisions. And she said, Heather, if we don't get this done soon, the window's going to close for my mom. She's already been diagnosed. She's in the early stage, and she's fighting me tooth and nail over finances, over advanced directives, over naming important things, in a way that is legal and official that we will all rely on going forward. But if mom doesn't do it now, we're going to get a lot more complicated in the future. How can I get my mom through the door to make these choices for herself in a way that feels right to her and to me? She had taken some of the communication strategies around dealing with distress because she noticed that her mom got upset and was really frustrated around the fact that, why is everybody asking me to do this stuff? I don't need to do it. There's nothing wrong with me, she said. I don't need to go in here and have all these appointments and do all of this stuff. It's not important to me right now. So this daughter is trying to get over the hump to just help her mom initiate some of these important life decisions at the right time. Well, she'd actually taken some of this strategy from a training that she had had and said, I used a positive physical approach. I settled myself and got down. And after a little bit of chit chat, I asked mom, if she was willing to think about taking on that appointment with me. And of course, mom launched into the whole reason why it wasn't needed and she didn't need help with it and she would do it on her own later. And I actually changed the vibe when I redirected just slightly and said, Mom, I think actually this is an important thing for all of us to do. Could I ask you, if I did it with you, if we could do it together? She said, I realize that I'm asking you to do something that I haven't done for myself, Mom. Yeah. Oh, how fair is that? Mom said, not very fair. And she said, I realize that, Mom, you're right. Mom said, well, it's about time. She said, you are right. I was wrong before to ask you to do this on your own just because I said so. But I really think that we could do it together. And I could really use your help in making some of these choices for myself. I think if we did it together, it would be easier for us both. In changing the feeling with some of those words, she was actually able to get her mom into a meeting where they accomplished all of these important life decisions, but they accomplished them together. She asked her mom at times during that meeting, do you think I'm making the right choices? Asking her mom as her mentor and the leader of their family, if she were making the right choices for herself. Her mom said, I think you've thought through everything. And if it feels right to you, she said, honey, then it's the right choice for you. Yeah. And that gave the daughter a chance to say, it makes me feel that you're making the right choices for yourself too. And the mom says, I will, because I'm going to do what's right for me. and the daughter said, yes, ma'am. And you've always been a role model for me in doing that.
What affirmation?
I shared with her another example. I said, caregivers like you inspire me every day. Another woman was thinking about her mother who had 11 ways of saying, no, I'm not giving up my driver's license, or you're not taking the car. And I'm not moving to the driver's seat while you're at it. I mean, to the passenger side. She said, I drive, this is my car, my license is valid, my insurance is, I've never had points on my insurance, and you're not taking this away from me. They went round and round over the car for weeks. Now, meanwhile, mom could not get the steps of a task done in order, and she constantly asked, where are we, in her own home? Her daughter knew that without situational memory, driving was no longer safe. But how to get her mom out of the driver's seat and into the passenger side seemed impossible when it was just an argument on the subject every time they opened the can of worms. Well, after learning a little bit more about these communication strategies, this daughter adapted them for herself in her situation. She said, I really had to think about something that was emotional to my mom, about how she feels about it. I wasn't going to convince her that she was no longer safe to drive. I had to let that go. I came up with part of a situation that really was feeling good to mom these days. She went on a jag. She told me about how this daughter, her son, was the first to go to college in their family. Something that she knew her mom was so proud of. And so she opened the subject with, Mom, you know, David's going to school this fall. And her mom said, I know, I'm so proud of him. He's such a good kid. And she said, well, Mom, there's only one problem. And the mom said, what? What is it? She said, well, in the first semester of school, I have a feeling that he really needs to work in addition to going to school in order to help pay his own way. Now, this was something she knew her mother felt strongly about. Absolutely. Our family pays our own way. He needs to learn the value of work. It would just send her, on a soapbox. He can work. It was good enough for me. And so knowing this about her mom, she said, one of the things that's going to make that possible, and the only way he's going to be able to get a job and hold it down, is if he has a reliable car. He doesn't have a car right now. The grandmother said, well, I'll tell you what. And she said, what, Mom? Would you lend him your car? And she said, I'll tell you what. He can borrow my car. He can borrow my car until he saves enough to get his own. And the daughter said, Mom, I knew you'd come through for us. Oh. I knew we could count on you. Yeah. And the mom said, we're in this together.
Wow.
She walked her through an emotional connection that made giving up her car feel better to mom in a way that could only be, sort of tweaked and tailored for their own situation. Right. The principle of the communication strategy is there, but it's tailored perfectly to solve the challenge that she was facing.
I love the wisdom that other people offer us and bring us. And my favorite question is like, what do I not know that I don't know, right? How can you share with us some of that knowledge and impart some of that wisdom with us?
It takes me to, I think, some words of wisdom from a caregiver who said something similar to what we mentioned earlier, Nicole, and that was just how much control, self-control, this kind of communication takes. And this is the way the caregiver pitched it to me after we had been together in a conference presentation all about communication and dementia care. This caregiver raised her hand. I'll never forget. She was in the front row and she said, "The most important thing I learned today." And I thought to myself, oh, here we go. What is it? Drop the wisdom at the end of the program. She said, "The most important thing I learned today was how important it is for me to get control of myself before I start communication with somebody else." She actually had a story about a client that she was caring for. This client, their communication seemed to just sort of spiral downhill every single morning. In fact, she would walk in to help this client with the bathing routine, the normal morning routine, just getting up, getting washed up and ready for the day, when this client would say something that rubbed her wrong. Every single morning, this client would say something that started their interaction on the wrong foot. It was a little insulting. It was a little something that, was inconsiderate to the caregiver. And what this caregiver realized was that it was getting under her skin every single morning. She said, "Heather, I know now, a better appreciation at least, for the fact that this person is losing control over their communication. They don't have as much judgment and impulse control to say the right thing in the right moment every time. And I know it's probably going to happen again tomorrow." She said, "But what I've realized today is that when I'm going in there out of control myself, my response is just making it worse." We laughed together because she says, I'm making it worse. I'm responding in a way that, rubs him wrong. And then he rubs me wrong again. And now we're just in an argument. I said, it's not illegal. Arguments are natural for all of us. But she noticed that they were getting into this little tete-a-tete, this little tit for tat, this little way of going back and forth of rubbing each other wrong. And it was all because she had lost control of herself. She said, "Tomorrow, before I start my interaction, before we start the morning routine that I know to be a challenge, I'm going to pause. I'm going to take a deep breath. I'm going to get myself centered and give myself just a minute to collect myself and calm my own little self. And I have a better shot," she said, "going in there tomorrow and turning this thing around. But it's all up to me to get control of me before I can get control of that interaction." And I said, drop the mic. The best thing has been said. Let's go out on that.
And the self-awareness to be able to look at ourselves and say, okay, I have some self-ownership of that, and how can I change that?
These are words of wisdom that have come from family members, from an army of CNAs who are out there, certified nursing assistants, home care aides, people who come to the bedside, to the dining room table, into our homes to help care for people living with dementia across a decade of caregiving. Some of the best expert noticers I've met. Yeah. So it's a treat to just get to share some of these stories from the road, some of these stories from my own family, from my own partners in dementia care. It also just inspires me to continue thinking about the principles of good, positive communication for myself going forward.
We can see parts of ourselves or our loved one in those little snippets of the story, right? And then relate to that, know how to move forward, be encouraged that we're not alone. I love how informative this has been, how fun you are. I could just listen for hours hearing the stories, hearing your presentation on it. I think you simplify it and the categories and how we can easily identify and put things, even with the changes with the brain, putting those in files, and then what types of communication and walking us through that. It's been so wonderful to have you share this with us. Where can we learn more about you?
Oh, I welcome folks to visit my website at Partnerships for Health. At Partnerships for Health, we're really doing consultation and dementia care education for families and organizations. Mm-hmm. So family caregiver consultation visits are a part of my practice still. It's how I have this ever-flowing, resource of family stories and good tips and strategies from those families that I meet every week. Mm-hmm. I'm meeting with families from all over the country in online visits, as well as consultation phone calls. If folks are listening from around the middle part of North Carolina, we could meet face-to-face in a place that's comfortable for you. In addition, I know there are so many professionals, organizational leaders, state association leaders listening to the podcast today, thinking about their role in supporting the families in their own community, in supporting the team members in their own organization. These are some of my best partners and clients. Mm-hmm. In some of the organizational work, we're partnering to create on-the-job dementia care education for all the members of your team, making that evidence-based, research-informed, and suited to the vision and mission of your organization. Mm-hmm. I welcome those contacts from organizational leaders who are looking for a partner in dementia care education. It's a treat. It's my honor to be with them. In addition to the work that I'm doing face-to-face with families and organizations in their territory, on their site, I'm also happy to connect visitors to my website with video recordings, with educational videos that people can watch in the convenience of their own home to learn more about not just communication with people who have dementia and some of these great strategies and many more in educational videos, but also how to really think about this disease over the course of progression over time to know when these strategies work the best. Mm-hmm. And when we can let go of old strategies that used to be effective to grab on to new ones that better match my loved ones' skills and abilities today. Topics like the progression of dementia and communication strategies in every level of the disease are all available on the website in educational videos that are convenient for professionals and families. Visit my website at www.pfhnc.com. That's Partnerships for Health, and I'm Heather McKay.
Thank you, Heather, and I'll include all of that in our episode description so our listeners can scroll down and see and click on the link. That's a great resource, and I can attest we're in video meeting today and you are dynamic and engaging. I wish that I had someone like you when I started my career in a senior living community, be able to teach some of those fundamental, I believe, absolutely vital, necessary communication strategies. So a call to everyone out there that it would be a great addition to your work and your community and your home. So thank you so much, Heather.
Thank you, Nicole. I appreciate the Will Gather podcast, and we are partners from here on out.
Absolutely. Thank you. Thank you for listening today. If you enjoyed our episode, please subscribe and give us 5 stars. In all honesty, we'd love to hear from you. Thank you so much for listening to our episode.